Hello, everybody. Thank you so much for taking the time to watch our presentation. My name is Sean, and I get to start things off by introducing our team. Our team name is QuaranTeam, aptly named for this season that we're in with the COVID pandemic. And that team is made up of myself, Ashley, Jackson, Alex, Aaron, Sarat, and Sarah. And the topic that we're going to be covering is wait times in the healthcare industry. You know, everybody has experienced this. You've arranged your whole day, your whole schedule to have a commitment for a short amount of time to make it to a doctor's appointment. You might have taken time off work. You might have had to coordinate with family to get your kids to go to an appointment. There's a lot of things that come into play here. Who knows? Maybe you've been asked to fast all day for an exam or for blood work. I know for some imaging exams, you have to show up with a painfully full bladder. And the very last thing that you want to hear when you arrive is, we're running a few minutes late. Or who knows, maybe you're not even told that they're running late and you sit there in pain or let bitterness build up in you as you wait for 15 minutes or longer past your appointment time. To make it even worse, you might get a stressed out staff member who kind of lashes out at you if you go out and ask a question about your appointment. So these are all things that we've experienced. And if you haven't experienced it, unfortunately, you're probably going to experience it at some point in your life. And so Team Quarantine, we really wanted to figure out a way to solve this. And I feel like we've come up with some good solutions and have some really good content to share with you guys. So before I get too far, I'm going to hand things over to Alex, who's going to talk about the issue in a little bit more depth. Thank you.
Thank you, Sean. Hi, everyone. My name is Alex, and I will be talking more about the issue. The Health Consumer Assessment of Healthcare Providers and Systems administered a patient survey regarding appointment wait times and patient satisfaction. The results concluded what most can assume, that long wait times directly correlate with a negative patient experience at a doctor's office. The patient survey revealed that every aspect of patient experience, specifically confidence in the care of the provider and perceived quality of care, correlated negatively with longer wait times. In essence, the patient experience is greatly influenced by the time spent waiting for clinical care. For example, if a patient is waiting 30 minutes past their appointment time without knowing why, everything else that happens after that, like getting their vitals taken, seeing the nursing staff, and the quality of care from their physician, is essentially perceived negatively because the time they spent waiting is perceived as less acceptable. For as many patients there are that arrive late, there are just as many that arrive early or on time. Sometimes late clinical care is attributed to factors within the office that are not in the patient's control. However, the main issue occurs when a patient arrives for an appointment early or on time and is taken back to be seen past their appointment time without notification. Oftentimes, facilities are short-staffed, running behind, or overwhelmed with a high volume of patients. Other attributes include impaired access to care, interruption of hospital work patterns, and patient dissatisfaction. All of these factors can lead to seeing a patient past their appointment time. The negative perception comes when clinical staff do not communicate or update the patient on the status of their appointment. By clearly communicating any delays early on and openly with the patient, the healthcare provider and clinical staff has an opportunity to mitigate any potential arguments, or more importantly, any negative experiences. Thank you so much, and next up is Aaron, who will be discussing the goals of our project.
Thank you, Alex. Hi, everyone. My name is Aaron, and I'll be going over the goals section for our project. So, the goal of our topic is pretty much stated in the introduction slide, which is reducing patient wait times. What this also means is that whether it's reducing wait times for patients waiting to be admitted into the emergency department or waiting for exam results while they're in the ER to determine further steps in their treatment, or outpatients having to deal with delays in the start times of their appointments and exams. The goal here and in any healthcare organization is to find ways to continuously improve patient satisfaction and the everyday workflow of the various departments of the hospital. So a lot of us in this class are healthcare workers or have worked in some kind of customer care environment, and we have to understand that waiting can be very frustrating, and our goal is to put that patient or customer first. So, and we got to know that patients sometimes wait weeks or months for scheduling an appointment, and they'll arrive expecting their medical needs to be met. And so when it comes down to a situation where we're presented with a patient that is dealing with these wait times, we're the ones responsible for relaying estimated delay times to that patient and providing a safe environment for them to wait in while we're working to meet the needs of that patient as best as we can. And so by decreasing these wait times, healthcare organizations will not only improve patient care, but can become more competitive in their markets and streamline their processes. Thank you. Next up is barriers and challenges. Thanks.
Thank you, Aaron. I'll be talking about barriers and challenges. The following have been identified as potential barriers and challenges to seeing patients on time. First is the physician has too many patients to see, which causes delays because each patient's problem is different and the time spent discussing the issues varies between patients. Second is not enough exam rooms. If there are not enough exam rooms available, then the medical assistant can't take the patient to the room on time. Third is overbooking of the schedule. The schedule staff are not understanding the scheduling constraints, clinical consideration. Scheduling staff might not know how busy the clinic is and might schedule more patients at a certain time. Next is understaffing. If there are not enough staff available, then it causes delays in rooming patients, taking vitals, and delivering patient care. Next is cleaning and disinfecting. Proper cleaning and disinfecting of the room is time-consuming and can lead to delays, especially during the COVID-19 pandemic. With the current situation, everything have to be wiped down with the disinfecting, including doors, chairs, and table. Next is verifying insurance. Verifying insurance is time-consuming. Sometimes patient representatives have to call the insurance to confirm if they were covering the service or not. Because of that, care can be delayed when insurance company deny coverage or request additional documentation, peer-to-peer review, and etc. In a medical setting, emergency and/or unforeseen circumstances are inevitable and impossible to plan for. It is possible, however, in these situations, to have honest communication with patients about delays and to introduce service recovery to mitigate the effects. Next up is going to be Ashley, who's going to talk about solutions.
Thank you, Sarat. Solutions to reducing patient wait times begins with schedule optimization. This entails not overbooking the doctor, the operatories, or the exam rooms. Schedule optimization can also be achieved by adding a 10-minute buffer to the appointment time in an effort to offset any issues that may arise. This also allows for extra time for sanitation purposes, which we all know is more important than ever now due to COVID. Finally, taking the time to properly train staff and adding regular follow-up training sessions for scheduling coordinators ensures that schedulers are up to date with the organization's scheduling practices. Improved organization helps with the overall flow of operations for the company or department. By setting up operatories and exam rooms the day or night before, time is added to the start of the day to allow and/or accommodate unforeseen issues that may come up. Collecting insurance information upon the scheduling of the appointment helps reduce the chance that the patient will come in with a new plan that would then require prompt verification. Designating one employee as an insurance verifier and/or utilizing a third-party verification service are also options to improving the wait times that patients may experience. Knowledge of the daily schedule and where coworkers are at with their patient load is a big part of improved organization. Having this knowledge allows for team members to see one another's patients, take vitals, and break down and set up rooms in efforts to keep the schedule running smoothly and on time. Honest and timely communication can help maintain and even improve patient satisfaction during less than optimal times. Honest and timely communication can be achieved by using a two-way texting feature or app. The texting app is more convenient and a less cumbersome way to communicate with patients than via email or phone call, and it allows for both the provider's staff and the patient to communicate with one another in real time. The texting feature can be used to let patients know in advance that the provider is running behind or that an emergency has come up and their appointment may need to be adjusted. In the event that timely updates were not communicated to the patient or he or she ends up waiting, a gas gift card can be given in attempt to offset at least some of the inconvenience for the wait. The outcomes of these efforts proved to be successful. My current organization has implemented these practices in the time since reopening from the COVID shutdown. We have experienced improved patient flow due to schedule optimization, increased patient satisfaction as a result of better communication processes, and improved daily operations by increasing efficiency and becoming more team-oriented. Up next is Sarah, who will discuss our team dynamics.
Thank you, Ashley. As we worked our way through this project, we definitely encountered the challenges known as the 5 dysfunctions of a team. The first thing that became apparent was an absence of trust, since we had never had an opportunity to meet in person. We did not have the time or the opportunity for team building exercises or to create a rapport. It was difficult to find meeting times that worked with everyone's different schedules, and we encountered some technical difficulties with the virtual meeting platforms. We also encountered the fear of conflict, as we were hesitant to make decisions without all of the team members present. We also had a fear of establishing and enforcing deadlines, since we had not yet built a rapport with one another. We found it difficult to reach consensus when making decisions for the group because it was challenging to get everyone together at the same meeting. We also experienced some ambiguity and at times inadequate communication. There were a few instances of missed deadlines, but overall the team worked hard to remain accountable to each other and to the shared goal. Scheduling conflicts, holidays, and personal family issues all contributed to a difficulty maintaining focus throughout the project, but we were able to persevere and get it finished. Now, I will take some time to explore the personality strengths of our team members and how they contributed toward our shared goal. Jackson scored the highest in the driver style on the lead style inventory and directing on the style matters conflict style inventory. He is decisive and prefers to be in leadership. He is proactive in making suggestions to improve the process. Jackson wants to involve leadership with clear objectives and expectations. Sean scored the highest in the amiable in the lead style and cooperating on style matters. He is dependable, detail-oriented, and excellent at communicating expectations and deadlines. He has high standards and is very flexible with finding the best way to compile and display information. Ashley scored highest in the driver style and the lead style inventory and compromising on style matters. She is decisive and enthusiastic and also flexible with last-minute changes. Ashley seeks solutions and sees things through to completion. Alex scored the highest in the amiable style on the lead style inventory and cooperating on style matters. Alex is considerate and approachable during team discussions. She sought to empathize with the plight of patients facing long wait times and also to create urgency when describing the issue. Now I'm going to turn it over to Jackson, who will talk about the strengths of the rest of the team members. Thank you.
Hi everyone, my name is Jackson, and I will be continuing personality inventories for our remaining team members and finish for what we learned throughout the quarter while working on this project. Using the lead and style matters assessments that we filled out earlier in the quarter, it was great to see the strengths of individuals' leadership styles help contribute to the overall success of the group. With my teammate Sarah, her strengths fell under the leadership styles of analytic and compromising. These leadership styles are preferred by leaders who are strategic and organized. This was quite important for the success for the group because it helped build a strong foundation for the team on when to expect to turn things in, along with the expectations that are required for each step. Sarah was a key player in organizing meetings, along with establishing a clear and precise timeline as the quarter was coming to a close. My other teammate, Sarat, had their strengths in leadership fell under amiable and compromising. Both of these styles are great to work with because leaders that use these styles are pleasant and overall very easy to be flexible with. This was particularly important to help identify the barriers and challenges that physicians and facilities have to overcome. Issues such as physicians having too heavy of a workload, not having enough exam rooms, and overbooking are all common issues that many facilities have to deal with. And having leadership that hears the complaints and being able to identify problems is a great thing to have. To finish off with personality inventories, I will conclude with Aaron, who fell under driver and analytic. Both of these styles were incredibly effective in identifying goals and benchmarks to fulfill, which helped the group to achieve overall success in finding appropriate solutions to achieve our goals, such as better scheduling optimization and delivering more efficient communication on delays and other sorts of information to deliver to the patient. I would say the three most important things we have learned from this group project was that communication, flexibility, and organization are all paramount for success. Communication being the first one must be consistent and transparent, whether by means of text messaging, Zoom, email, FaceTime. They were all important ways or all effective ways for communicating with each other, especially during the pandemic where we weren't able to see each other face to face, as well as most of us having full-time jobs where outside of schoolwork we really don't have time to be able to meet with each other due to some of us working at night, some of us are working during the day, so being able to effectively communicate was very important. Another important factor was flexibility. Being flexible and being open to compromise was important to make sure that we were able to cater to everyone, since, like I said in the previous bullet point of communication, since all of us were working on different schedules, we had to make sure that we were able to cater to everyone's needs. So being able to be flexible with each other was also another important factor. The final one I have to say is organization. Establishing hard dates for tasks and following through was important to make sure that the project was to be completed on time. Establishing the outline and having hard deadlines within the group to make sure that certain things were done on time was a very effective means, and that all three, I'd have to say, are very important for overall success. Overall, I'd have to say our group was effective in all three things, which made completing this assignment an overall success and allowed our team to not only identify what the problems were, but as well as being able to identify team goals and help come up with alternative solutions to help address some of those issues. So I have to say, so on behalf of the team, we would like to say thank you for listening to our presentation.